Hello, my name is Bryce Mario, and the purpose of my persuasive speech is to argue the importance of a universal healthcare system in the U.S. According to PBS.org, about 44 million people in this country have no health insurance, and another 38 million have inadequate health insurance. That means that nearly one-third of our country is without adequate health care. This topic is so pertinent to all of us, and it should be discussed and debated for the health and safety of all Americans. I chose this topic because I have a genuine concern for the uninsured, because I recognize the importance of health insurance and health care. I was also very interested in learning and researching more on the topic. After much research, I came to the conclusion that the U.S. should consider implementing a universal healthcare system because it saves the lives of those in need, boosts the economy, and healthcare is a recognized human right. Let's begin with how universal healthcare would help save the lives of those in need. So according to a 2009 study from Harvard researchers, lack of health insurance is with as many as 44,789 deaths per year. That's a 40% increased risk of death among the uninsured. This is because not everyone can pay. If they cannot afford the price of health insurance every month, they will not get health insurance. Therefore, any medical bills will have to come out of their pocket. And because if a universal healthcare system is implemented, because everyone will have access to healthcare, they will be able to be treated without having to worry how they will pay for the care. One interesting study that was done in Massachusetts in 2006, they began requiring everybody to have health insurance, and their death rate decreased by 2.9% by 2010. And then according to the study, which was led by Benjamin Summers of the Harvard School of Public Health in Boston, that translates to around 320 lives saved every year. Because the people were required to have health care, they were able to get the care they needed. So it's very important that everybody has access to health care. One quote by Dr. Steffi Woolhandler, a professor at the School of Urban Public Health at Hunter College and a co-author of the Literature Review, told CBS News that losing health insurance is lethal and gaining insurance reduces the death rate. That is a completely consistent study and proof through many studies. It's been proven over and over again that if there's a lack of health insurance, the death rate rises, and if there's easy and accessible care, the death rate goes down. We have talked about how universal healthcare could save American lives. Let's consider the economic effect it would cause. So, according to ObamaWhiteHouse.archives.gov, it would put more money in families' pockets, which would in return boost the demand for products, and it would bring down the employment rate. Because his bill that President Obama submitted, which was known as Obamacare, it had tax credits to help pay for health insurance premiums for those who could not afford it. Therefore, they would have more money in their pockets directly to them, and this extra money, excess money, would go back into the economy because they would be more free to buy things that they needed or wanted. And then it would also improve health and making workers more productive, because you would have access to to doctor visits and checkups, and you would be able to go to the doctor without having to worry how you would pay for it. You would be able to be healthy and make sure that you took care of your body. Therefore, you could go to work more often, stay at work without having to worry about sick days, and that's positive, and it boosts the economy. Now that we have talked about the economic impact, let's consider whether or not healthcare is a basic human right. So the right to healthcare is an internationally recognized human right. On December 10th, 1948, the United States and 47 other nations signed the nation's Universal Declaration of Human Rights. The document stated that everyone has the right to standard of living adequate for the health and well-being of oneself and one's family, including, but not limited to, medical care. So basically, we came together with a bunch of other nations and decided that there's a certain standard of living that everyone is entitled to, and this includes healthcare, which is really puzzling to me why we haven't implemented a universal healthcare system if in 1948 we signed this document. An interesting fact is that the United States and Mexico are the only countries of 34 members of the Organization for Economic Cooperation and Development that do not have universal health care. This is interesting to me just because I think if other nations find it so important to provide health care for their citizens, then I think the U.S. should consider it as well. And another supporting fact for the idea that universal healthcare is a recognized human right is that the Constitution supports the right to healthcare. So according to the Constitution, there are certain unalienable rights, and that is life, liberty, and the pursuit of happiness. In order to have life and liberty and pursue happiness, one needs to be healthy and be able to not have a burden of how they're going to pay for their health care on them. And then according to former Congressman Dennis, I can't even say his last name, Kucinich, as part of efforts to promote the general welfare and healthcare is a legitimate function of the government. In conclusion, universal healthcare is a topic that has our nation divided. Throughout my speech, I have discussed how the system would save lives, boost the economy, and the importance of healthcare as a basic human right. It is my opinion that not only those who can afford health insurance should get medical care. This is why I support universal healthcare. I would like to conclude with a speech from Sherry Guild, PhD, Associate Professor of Public Health at Columbia University. So the people who are most at risk today are those who have no health insurance at all. They're at risk of not getting regular care when they need it. They're at risk of not catching real problems before they get serious enough to not be treated. They're at risk of not getting the best treatment when they actually do get sick, and they're at tremendous financial risk. They could lose everything that they've saved in their lives because of some even fairly minor health problems. This is why a universal healthcare system is so important to be considered for the U.S. government.